Conditions of Childhood and Adolescence, Module 3, NCLEX Review and Clinical Application. You must distinguish these disorders clearly. Autism affects social communication. ADHD affects attention and impulse control. Oppositional defiant disorder involves defiance, while conduct disorder involves harm and rule violation. Younger children are harder to diagnose because development is still evolving. Your communication must match the child. With autism, be literal and calm. With ADHD, give one instruction at a time. With oppositional behaviors, stay consistent and avoid power struggles. If your communication escalates behavior, it needs to change. Here are the do's and don'ts to therapeutic communication. Therapeutic communication varies by disorder. For children with autism, do use concrete, literal language. Do allow processing time. Do maintain consistent routines. Do allowing stimming for soothing. Don't use idioms, sarcasm, or metaphors. Don't force eye contact. Don't make sudden changes without warning. For children with ADHD, do give one instruction at a time. Do make eye contact before speaking. Do use visual cues and reminders. Don't give long, complex directions. Don't expect prolonged attention. Don't punish without clear explanation. For children with ODD or conduct disorder, do set clear, consistent limits. Do remain calm and matter-of-fact. Do offer choices within limits. Don't engage in power struggles. Don't take defiance personally. Don't make threats you can't enforce. On the NCLEX, questions will test whether you can identify appropriate nursing responses. Choose answers that are calm, consistent, and developmentally appropriate. Safety is always the priority. Children with autism may wander or become overwhelmed. ADHD increases risk for impulsive injury. Conduct disorder increases risk for harm to self or others. When in doubt, choose the intervention that protects safety first. Safety is always the NCLEX priority. Here are the key safety concerns by disorder. Autism, concern of elopement risk, children may wander. Self-injurious behaviors during meltdowns. Seizure precautions. Remember, 1/3 of children with autism have epilepsy, and sensory overload can trigger aggression. ADHD. Impulsivity leads to accidents and risk-taking behaviors. And consider medication side effects. Monitor cardiovascular status with stimulants. Conduct disorder, violence towards self and others. Suicide risk, especially with comorbid depression, fire-setting behaviors, and substance abuse. NCLEX priority. Questions. When asked, what should the nurse do first? Ensure safety of patient and others. Assess the situation. Implement appropriate intervention. Document and evaluate. Remember, a child expressing suicidal ideation requires immediate intervention regardless of diagnosis. You are not just treating the child, you are supporting the family. Caregivers may feel overwhelmed, frustrated, or guilty. Your role is to educate clearly, validate their experience, and connect them to resources and support systems. Family-centered care is essential in pediatric mental health nursing. Key nursing responsibilities include education. Explain the diagnosis in understandable terms. Discuss treatment options and expected outcomes. Teach medication administration and side effects. And provide written materials and resources. Support. Acknowledge caregiver stress and burden. Connect families with support groups, assess for caregiver role strain, and provide respite care information. Advocacy. Help families navigate school accommodations, IEP and 504 plans. Connect with community resources, and ensure access to appropriate services. NCLEX application. Questions may present a stressed parent making statements like, I can't handle this anymore. Nothing works with this child. I feel like a failure as a parent. Best response. Acknowledge feelings, provide support, and connect with resources. Avoid minimizing concerns or offering false reassurance. If you take one thing from this, remember this. Early identification matters. Structure improves outcomes. Family involvement is essential. Behavior and medication together are most effective. And safety is always your first priority. Your communication as a nurse can either stabilize the situation or make it worse. Be the steady presence. Every interaction is an intervention. Show up with intention.